While it has been around since the 40s or 50s, Prolotherapy, which is short for proliferant therapy, has only recently become more common in its use. Now, fortunately, we have the ability to heal ourselves in a variety of ways, but for some reason, some areas get injured and it just doesn't continue to heal to completion. Proliferant therapy, or Prolo injectable therapy, is a way to help the body continue to heal itself to the completion such that pain relief occurs. There are a lot of different compounds out there being used. Some of the popular ones have been serapin, which is a chemical that comes from the pitcher plant. There's also sodium mauryate, which is a derivative of cod liver oil. But the one that's most commonly used and the cheapest and the safest is actually a medical grade, high density, high concentration dextrose, or a fancy sugar solution. Now, these things, when injected into an area like a tendon or a ligament where it attaches, or even an arthritic joint, makes the body think it's been injured. The body sends extra blood supply, extra nutrients, and some stem cells from your circulation to that area to try to heal the injury. Now, after a while, your body kind of recognizes it does not have an acute injury, and the whole process begins to slow down. But that's the fortunate thing about prolotherapy. You can repeat it again and again. Now, instead of being done at weekly intervals like visco supplementation, which we also do here, this is done every 2 to 3 weeks, and in some practices every 4 to 6 weeks, because there's a lot of variability in the approach and the concentration of the fluids, etc. But if you keep the healing momentum going by doing these injections every 2 to 3 weeks, the joint or the ligament or the tendon just very slowly begins to heal, and most people who have pain or laxity just see a continual slow improvement until they're painless, in which case we stop, of course. Now, in our office, we do no more than 6 injections and then wait for the environment to calm down to see if the pain is going to go the rest of the way away if somebody doesn't have complete pain relief. And people so routinely get some pain relief within 3 injections that if somebody comes in for a 4th injection and they've had no pain relief, we typically stop because they just happen to be one of those rare non-responders. Now, thank you very much for coming to see us today, and we hope that you learned something from this. I am Dr. Ron Gardner with Gardner Orthopedics.